Imperial, Nebraska is a small town of about 2,200 people. The community itself is very accepting and welcoming to new people to the area. It's a big farming and ranching community. Actually, what started me in the nursing field was I wanted this 79 Camaro. And my dad said I had to have a job, and he says, "What?" And so I was trying to think of a place to go work, and he says, "Well, why don't you go see about working at the hospital? You always like helping people, so why don't you try that?" And I actually never ended up getting the car.
My name is Jean Allen, and I'm a family nurse practitioner in Norfolk, Nebraska. My journey started actually when I was in grade school and high school. I grew up in a medical family. My mom is a nurse and my father's a surgeon, so I've been around medicine my whole life. In college, I went to school, got my Bachelor of Nursing, and started working. I did a lot of jobs in Omaha and then moved up to the Norfolk area and started working in family practice. It was there that I realized that I'd like to actually go the next step in terms of analyzing what was going on, making diagnoses, and figuring out what to do with those problems. It was about that time that the nurse practitioner program came into being in Nebraska. I applied and got into the family nurse practitioner program.
Hi, my name is Michaela Small. I am a family nurse practitioner. I live in Humphrey, Nebraska, and I practice in Midtown Health Center out of Madison, Nebraska. Come on. The most amazing thing about working in a rural clinic is that you do everything, and I think people don't realize that you are everything. You might have somebody walk in with an issue and you got to figure it out.
During the summertime, we'll load up about 10 or 15 residents, take them for a tour of the countryside. A lot of them are old farmers and ranchers, and so they like to see the countryside with the whatever corn or soybeans growing or the cows out in the field. Winter time, we'll load up. We'll do a few nights out of the week and do a tour through the town for the Christmas lights.
One of the things I especially enjoy doing is pet therapy. This is one of my pet therapy dogs, Maggie. We go and visit patients and try to relieve some of their stress. We spend time with their families, trying to just distract them from some of the stress of their families their loved one being in the hospital. One of the advantages of being in a rural area, I think, in healthcare, is that we really have relationships with people. What that does is it builds trust. So they trust that I'm going to give them right counsel, right information, and that I'll lead them in a way that's going to lead to a healthier lifestyle.
I think for advancement, I think I'm looking more at always building my practice. It's not so much climbing a ladder for me as it is being a person that everybody knows in town and everybody connects with as somebody they can go to. And I think that is really, and then also becoming involved in the town. Right now I have small children, so my biggest involvement is I'm in the rescue squad, and so I volunteer my time there, and I'm very active in that. And I really enjoy that. As my kids get older, I'm excited to become more involved in the community and more of a leader in the community.
Another avenue that rural nursing has, as opposed to urban, is you treat both ends of the age scale. You go from delivering babies to pediatrics to middle age to older adults, and it can all be in the same day. At these hospitals here, you're kind of there isn't the specialized different departments. You treat everything. A child might come in with an asthma attack, and so you're treating that, and then you might have a 65-year-old that maybe broke a hip or has pneumonia or something. All in the same day. They can be literally a door apart from each other. You get to utilize the full extent of your nursing skills in the rural setting. You're not just focused on one area.
That's the nice thing about nursing, is there's a lot of options and a lot of pathways. If they're interested in becoming a nurse, I would shadow a nurse wherever you can. A lot of times if you're in high school or out of school, the clinics will let you shadow a nurse, and that really gives you an idea of if you want to be a nurse or not. We show them different things. We do some CPR, some mock trauma stuff, but it kind of tells them a lot about the nursing role and see if they want to do that.
Oh, I'd say go for it. I love nursing. It's, obviously I'm like poster child for loving nursing. I graduated with, 50-some nurses, and they have all taken different roles. Even here in Madison, we have nurses that work in occupational health, we have school nurses, we have mental health, which I think a lot of people coming out of high school don't realize that behavioral health nurse practitioners are in such high demand, especially in rural areas, that if they're interested in things like psychology and sociology, that maybe they should get a nursing degree. I think that nursing is it's just a sound, you can just go anywhere with it. Everybody needs healthcare, so it's a great degree to have.